Hello students, welcome to this session. So today we are going to study about blood collection procedures. So they are venous, capillary and arterial. So we will see all these in detail.
Hello students, today we will have blood collection procedure lecture. So blood collections are of three types: venous, capillary and arterial. So first we will see things required for blood collection. So what should be there in your blood collection kit? So there should be syringes of different sizes like 2 ml, 5 ml, 10 ml, needle of different sizes like 24, 22, 21 and 20 number, spirit, cotton swab, bulbs like EDTA for CVC, plain for all biochemistry and serology, fluoride for blood sugar level, citrate bulb for blood coagulation testings, tourniquet and sticking for the vein to become prominent, and then for the last sticking for the pressure. So first is site. So it is median cephalic vein of the forearm, or the whichever palpable, visible, prominent vein we can select of the arm, forearm, or from any wrist. Then select the vein and then clean it with spirit swab, and then apply tourniquet to make the vein prominent, and ask the patient to close the fist so that vein will become prominent, visible, and then with left hand steady the vein and then put needle into the skin and then puncture the vein, and then collect the blood. Plunger is pulled back gently when blood starts flowing into the syringe. Then remove tourniquet, collect adequate amount of the blood, and then ask the patient to open the fist and then remove needle, syringe, put pressure with spirit swab at the puncture site, and then put your collected blood into the appropriate container. Then you have to put pressure for 10 to 15 minutes to avoid the complication like hematoma. Hematoma is the seepage of blood in the subcutaneous tissue. So uses of venous blood. So all hematological investigations. So preferably venous blood we require mainly for the very large quantity of blood is required. So like hematological investigations like ESR, PCV and other cell counts, biochemical investigations where the serum is required, serological investigations where the serum is required, and for blood culture. So second method for blood collection is capillary method. It is also called as prick method or skin puncture method. So site in mainly adults it is ball of the left ring finger or lobe of the ear. In infants it is ball of the thumb, great toe or heel. Procedure: so first you have to clean the part with the spirit swab, and then you have to take lancet or needle and then prick that area with help of lancet or needle, and then first few drops you have to wipe out because it contains tissue fluid, and then remaining blood is collected and then investigations done. So here you can see this third method. It is arterial blood collection method. So in that radial artery is preferred, and then that is felt with 3 fingers at the radial side of the wrist joint below thumb, and then where the radius bone is there, then clean that area and then puncture the needle, puncture the site with needle attached to syringe, and then blood will come into the syringe, and then adequate quantity of the blood is withdrawn, and then apply pressure for 10 to 15 minutes with spirit swab. Uses of arterial blood: so usually it is required for blood gas analysis, and then it is done in patients of ICU patients. And uses of capillary blood: it is bleeding time, clotting time, hemoglobin, blood grouping, malarial parasite, total WBC count, differential count, RBC platelet retic count, peripheral blood smear report. So mainly capillary blood is required where the less quantity of blood is there. Thank you. Thank you.
These are my references from which we can study. I hope this session you will find useful. Thank you.